Go ahead.
Good evening, everyone. Welcome to the Optimal Longevity Series. I'm Dr. Russ Kort. I'm here with Joanette, and we have a great program for you tonight. We are going to open your eyes and open your ears to the world of neurology. Jed's been working hard on this, so hang tight. It's going to be a good night.
And we would like to go ahead and welcome our very special guest, Dr. Prasad. Dr. Kort.
But first...
Oh, we need to do the disclaimer.
We need to do the disclaimer.
That's right.
Hit it, Jeff.
All righty. Thank you, everybody. I'm going to just go ahead and pull you guys off of the spotlight. Oh, Helen just popped in here, but that's okay. Let me just read the disclaimer. I will get this taken care of. Remove spotlight and here we go. So follow along with me as I read. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only and includes information on recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition we are lacking. Nothing here is intended to be a substitute for treatment or a visit to your primary healthcare provider. So I think we're done. We'll go ahead and hand it back to you guys.
Thank you, Jeff. Appreciate you. You ready, sir?
I am.
All right. We'd like to welcome our very special guest, Dr. Prasad. Russ, do you want to go ahead and read his accolades tonight?
Love to.
Okay.
It is with my great honor that I introduce Dr. Prasad, or Kedar Prasad. He was a professor at the University of Colorado School of Medicine for more than 30 years as the director of vitamin and cancer research. He was also the former president of the International Society of Cancer and Nutrition, and he was a member of the London British Society of Medicine. He was also personally invited to sit on the Nobel Prize nominating committee for candidates in medicine. As many of you know, Dr. Prasad is the world's first PhD radiological biologist, and I like to add that it was a 7-year program, and he did it in 3. He was also awarded 7 U.S. patents. He discovered the anti-cancer potency of vitamin E succinate and also discovered butyric acid, which also has anti-cancer agents. Dr. Prasad is author or co-author of more than 32 textbooks. He's also published well over 250 peer-reviewed articles, and he is listed in PubMed more than 450 times. So it's with great honor and great reverence that I introduce the living legend, Dr. Kedar Prasad.
Thank you, Dr.
You should have like this.
Kind introduction.
You know, all these. Jeff, work on that for next week.
Oh.
Okay.
Well,
I'm going to go ahead and describe the Optimal Longevity Series real quick.
Let's do it.
Sure.
Why we're here, why we created this series. All right. On the screen, if I can see, here we go. Your lifespan is how long you live. Your health span is how many years you live a healthy, vibrant life. And we want your health span to equal your lifespan. And Dr. Prasad is such a great example of this. The top part of this schematic, this normal aging today, the last second season of our life, you know, there are a lot of age-related diseases, and it doesn't have to be that way. We really want you here in the Optimal Longevity Series to be able to have that optimal longevity so that you can have a healthy, vibrant life. And that's really why we have this each week. And we're so grateful to have you, Dr. Prasad. Thank you.
Thank you, Joanette.
Okay. So we were talking about last time about our study at UC Boulder, but what we didn't get to talk about there were some of the biggest complaints that our case study had, and that was really about his eyes.
Yeah.
He really suffered from going outside, bright light. And when I would measure him on the EEG, he would have this eye flutter because of all the damage done to his eyes from the exposure at his job.
You know, Joanette, he even suffered in his house because just the light in his house, just the daytime light, He would wear glasses like these all day long. And then he'd even wear them in the shower, and he'd take them off and hand them to somebody and just wash his hair with his eyes closed because his eyes were so sensitive.
And basically he would say, I just can't take it anymore. And we didn't really understand until I was looking for the image. We did thermography imaging on his eyes. And most of our eyes should be like a blue-green color in temperature. His were white. So that the whites of our eyes and the retina and the pupil, all of that area was white hot. So we knew that there was a lot of oxidative stress and damage done there, Dr. Prasad. But the really cool thing about that I didn't get to share in the study, and it's probably one of the most fascinating things, is that we could see in the EEG that he, because of the eye flutter, the first two leads of the EEG, I couldn't get a read. But what was happening is that behind the scenes, he wasn't making any peak alpha waves. And over time, over the 26 months that he was on the micronutrients and the multimodality, he did have peak alpha waves. And then at the very end, he had a very normal, healthy brainwave. And that was just really exciting. But here it was all this movement and the stress from the eye. So it got us thinking about, we want to talk about eye issues, and they're very common. And even though, today I did a course, this is really one of the reasons why I did this, on omega-3s, which is a single micronutrient approach. And so all this research on dry eye, which we're going to talk about tonight, age-related macular degeneration, and diabetic retinopathy, and the direct relationship to the imbalance of DHA, EPA, in the eye, and the omega index, Dr. Prasad. But again, it was a single micronutrient approach. And it really did say that it was, let me turn back to my notes here. It said it was positive, but could not be a standalone treatment, but as an adjunct. Okay. But the research is out there, and we'll talk a little bit about that, which I thought was really fascinating now that you've brought the omega-3 into the suite of products. So let's talk about dry eye first. And this is one of the first symptoms that people have. Let me see where this one is.
Here, first you have to know what is happening in the eye. For example, retina part of the eye is highly oxygenated. This is true. And when you have light hits, even sunlight, radiation is well known to induce cataract formation. Is very well known because it generates oxidative stress. So I presume that even though the EMF radiation also can contribute to the eye damage, even the light, there is a high incidence of cataract in the region where you have more sunlight. This has been published epidemiologically, a study. Why? Because all these things affect the oxidative stress of the eye. And because retina is so highly oxygenated, until you have sufficient amount of antioxidant in the eye, they can't be protected. And average people take a poor diet, it is worse scenario. Whether it's a macular degeneration, which is advanced stage, or diabetic retinopathy, which is advanced stage. But in all those cases, oxidative stress is involved. So this is a very central issue. And so that's very interesting. In all those issues that you mentioned, even the genetics of eye disease that I published it, in a patient who has genetic and measure the oxidative stress, they are very high. And so the question is, even in a genetic cases of eye disease, question is, can you delay the onset of the disease? Because long before the symptom appears, you have increased oxidative stress and increased inflammation. So if you block them, then it might be delayed much later that you can have this kind of even genetic disorder. So in the eye, it is extremely important to understand how we can increase. We have a micronutrient, but a type of antioxidant we have in macronutrient cannot cross as much as you like to have in the eye. It just doesn't go in a sufficient amount to protect it. It will protect better than those people who are not taking it at all. And that's why as you know, that eye pigment has a lutein and zeaxanthin. Human pigment has And these are very strong antioxidant and anti-inflammatory agent. And all the clinical trial which has been done in macular degenerations and other issues is done with the two products, is a zeaxanthin and lutein. So when I was developing the eye boost program, then I will come back to the omega-3 issue. Then when I was developing the eye boost program, then I said, what else could be there that can protect better? Because it has protected some better than just micronutrient alone, lutein and zeaxanthin. And because they accumulate selectively in the eye. And so I was looking literature, came across that the birds, the prey, for example, way from the sky, see the prey eagle. I said, how come they see so far distance? And looking on their biology, they found out they have an additional pigment called astaxanthin. Then I look, is that astaxanthin, how come human lost during evolution? And I don't know, because they don't have to pray like that, like the birds have to make a living. So it was maybe evolutionary that we did not need it, so we lost it. But nevertheless, I looked at toxicity of astaxanthin. I found it is very non-toxic, as non-toxic as zeaxanthin and lutein. Plus, it accumulates somebody acid 500 times more than any other antioxidant in the eyes.
Mhm.
And you can imagine that if you have astaxanthin plus zeaxanthin and lutein and micronutrient, your eye will be highly protected against oxidative stress and inflammation. Then therefore, the risk of developing any kind of eye abnormality will be markedly reduced. And then comes to, so, well, like Joanette mentioned, it is a multimodality. Just micronutrient not alone is sufficient. It will do some good. Or if you just take a eye boost, it will do some good, but may not be enough. You also know other kind of, because they all work in a synergistic manner. And then comes the new kid in the block is omega-3, because it is an essential fatty acid that our body don't make it. So all organs in our body will require this, not just the eye. And so, but people get excited about it and did a study, and that's why only the animal model they have done it, and they found that it improves the eye, and so. But sometimes any animal study with a single micronutrient, like Joanette was mentioning, can have some effect, but when it goes to human trial, you will see some effect, but may not be the optimal one. And so omega-3 fatty acid, because it is a excuse me, it is essential fatty acid, all organs in the body will need it. It is important in Alzheimer's, it is important in diabetes, you name it, because all organs have this problem that they need for survival, for normal functioning. And so for the eye, I think and that's why Kort 4 would be extremely important for prevention and for the management of eye disease of any kind, whether it's a macular degeneration, whether it's a glaucoma, whether it is a retinopathy, any type of things, this Kort 4 would be the best because they have multimodal, and if you want, I can describe.
Yeah, Kort 4
Kort
plus
4.
eye boost, right?
Yeah, Kort 4 plus
An
eye boost.
enzyme boost. So
Huh?
Kort 4 plus 2.
In the enzyme, you mean the digestive enzyme? Yeah.
Right. Right.
Kort 4 plus 2. So it is a multimodality, efforts to, if you want to protect your particular organ, you cannot use just one agent. But
Well, we have to look at, the last 25 years, we're on screens more than any other time in history.
Mhm.
And now we wake up, first thing we do is look at our screens. We're on screens.
Yes.
A lot of my patients have 2
Yeah.
to 3 screens that they stare at during the day.
Exactly.
And then their phone screen pointed at their abdomen right in front of their keyboards, so they can look down whenever they're getting a text message. And this is the part where we start to talk about the fact that the eye doesn't have any protection.
No.
It's a lens, and then you have the inside of the eye, and the only protection we have to the optic nerve is just a little bit of aqueous.
Yeah, yeah,
That's it.
exactly. And this is that's very important point that you mentioned it, and that's why the single agent can be a good strategy to affect any kind of prevention or treatment strategy. And we feel that if you combine those two things, and your eye will, and EMF radiation has additional mechanism damage that, as you know, ionizing radiation doesn't. Both produce free radicals, inflammations. One is X radiation produces a little more than the EMF radiation. But what the EMF radiation does, that radiation like X-ray or gamma ray doesn't do it, it vibrates the charged molecule in your body, like sodium, calcium, potassium, which are charged. Many other particles, sometimes molecules have unpaired electrons, so it is free radicals. So there are a lot of, at a given time, a lot of charged particles. And when they get vibrated by EMF radiation, even though it is a low dose, they become very sensitive to damage, oxidative damage. And so this is very important to remember that, but if you, antioxidant, if you give them micronutrient, they will at least neutralize many of those, which has unpaired electron, and therefore you will see some immediate benefit, and as well as long-term benefit as well.
I think that's going to segue to the dry eye part, because we actually talked about osmolarity in dry eye a little bit, and that would be affecting, right? If there's vibration going on in there, Dr. Prasad, that could be another factor why we have dry eye. And so
because secretion from the gland, I forgot the name of the gland, that it is markedly reduced by virtue of increased oxidative stress, whether it is coming from EMF radiations or an environment or any place, or just light, sunlight.
So let's talk about the first one, which is dry eye, which is very common.
Sure, very common. Yeah.
We're going to talk about this because this is a really, Dr. Kort, can you read those symptoms off for us?
Is this the one that I can't read it because it's...
No, this is a good one. You can see this one.
Okay, so burning or stinging in the eyes, redness of the eyes, blurred vision, and watery eyes.
Yeah.
And before the Omega came out, I had a lot of problems with my left eye watering constantly. And, driving, when headlights would hit my eyes, I'd be like, oh, rub my eyes, because I had a cataract forming in there. And you and I have talked about...
You skipped ahead a little bit, but that's okay.
We will, but we're going to hit it again. But we've talked about that, and that's how we really got into the eye formula long ago.
Yeah.
So
I think that's very important, because those glands get damaged by this kind of exposure that we are. And so if you protect them from there, then maybe they will recover and start secreting. In analogous to insulin secretion, remember, there is some mechanism there that the enzyme goes up, and then insulin secretion from the pancreas is reduced. So here comes collagen peptides, they restores that damage. So it is possible that dry eyes that you are seeing it, the secretion from the gland is not functioning well. In order to protect them, you have to have micronutrient to protect them. And once they are protected, and these are not the just a fixed number, some cell in that, at least those who are producing the secretion, must be proliferating types. And so I think it will be, once they are protected from future damage, then maybe their function will restore and will start secreting more fluid, and then you will not have a dryness of eyes. There is no clinical study done on this issue. And so I think, but the experience of Dr. Kort tells us that is a possible protection, because he's taking all those core 4+2.
So with the dry eyes, we learned she spent the most of the time, there's quite a few studies that they've looked at. Some were very, very big cohort studies looking at the dry eye, but most of the time it's more prevalent in women over 60.
Yes.
30% of the population will have dry eye sometime in their life, but the overall arching on all the studies was that increase in dry eye with the imbalance of the retinal fatty acids was a strong correlation, where there should be 50% DHA in that retinal fatty acids. And when it's lower than that, then they would have more dry eye symptoms. And so I thought that just really dovetailed into the work and the unique formulation of your omega suite, because it's just not EPA or just DPA. You did your, I'm sorry, DHA.
Yes.
DPA is one, DHA,
DPA.
and the suite that you put in there with the GLA and the ALA. It's a very thoughtful formulation, but that was very interesting to me. And then how the they looked at the tear. When you blink, the tear should be going over the eye. And then they also looked at the osmolarity, which would be the salt, that percentage. And all of them were directly related to the increase in dry eye and the imbalance of the retinal fatty acids and the lower DHA.
So
Yeah.
here's my question. This is clearly affecting the lacrimal gland in the eye. And do you think it has anything to do with the proximity that we hold our devices, or the proximity or the amount of light coming out?
Of course, that contributes it. But what she's saying also, that contributes to disturb or reduce level of DHA in the eye, because, but another thing is that if you take omega-3, you have not taken omega-3, for example, but normally you have certain amount of omega-3 in your body, because even ALA get converted, or EPA gets converted a small amount. But when they get oxidized, they become not only ineffective, in some cases could be harmful.
It could
So
be
the fatty acid, it get oxidized.
yeah.
And so supplementation of omega-3 is so important for anything like nervous tissue, like in a brain. And brain also, like you mentioned, that in the eye, in the brain, 40% of the membrane fatty acid in the brain is DHA. So you can imagine how important the DHA is. That's why the supplementation that we have, EPA and omega-3, is extremely important. It affects all organs in your body.
So Dr. Prasad, all these studies were really looking at the omega-6 to 3 ratio and the omega index for the dry eye. And there was 4 different studies looking at that, but the overall systematic review that it did work, but that it was not a standalone.
Yeah,
and that
exactly.
treatment, but it needed as adjunct, which really goes along beautifully with your multi-micronutrient approach that you've been stating for
For a long
3
time.
decades, right?
Yeah.
And you've recommended omega-3s in your books and research for years and years. So the next disease we want to talk about is age-related macular degeneration, which is, and I'm so glad you explained like the retina from that oxidative standpoint, because they were talking about it more from a functional standpoint, and where it was located and the different types of rods and cones and all the different things. It was a little bit much, but for me, the age-related macular degeneration was really, they did a very large cohort study, Dr. Prasad. It was a nurse health study, and they had over in 2017 nurses. They had females, 75,000 nurses, 75,891 nurses, female, and they had 38,000 male, 38,961 males over the age of 50. And they were looking at their amount of omega-3 in study. I mean, their food survey. And that's a big cohort. And so what they found that if the delayed symptoms of AMD, when they increased the omega index of the EPA DHA and it was statistically significant. And and they primarily looked at the leaky blood vessels grown under the retina, under the wet. It was the wet type of AMD. But still, that's over 100,000 people that they looked at that were nurses, and how the statistically significant marker delaying the symptoms of that AMD based off of the omega index, which is really the EPA DHA ratio. So I thought that was awesome. But when people have AMD, this is really scary for people. I mean, they lose the center field of their vision, and then blindness. I mean, like, this is a very serious disease. And so with that, I think just dovetailing from what we talked about with dry eye, that the Core 4 and then the eye boost could be very helpful to these people, because this was just based off of food, Dr. Prasad, off of if they had enough omega-3s.
Yeah.
Tuna.
That's again is very important. But another component is the macular degeneration is proliferation of the microvessels, because EGF, VEGF is increased the growth factor. So this causes an increase in the proliferations of the fine, tiny blood vessel in the eye, which sometimes they can get ruptured and can bleed. This is a wet type of macular degeneration. And we have in our micronutrient, we have vitamin E succinate, which turned out to be anti-VEGF, the growth factor that causes proliferation of the microvessels. They will block it. And so you don't have a proliferation. So still there is no leakage of these. So it will improve. But again, by itself is not sufficient. But at least we have in a component in order to oxidative stress and inflammation that are responsible. But at the later stage, you have these kind of reactions. But we have in our properties happens to be vitamin E succinate, which are known to be block the proliferation of microvessels by reducing this growth factor.
You know what? So you always sneak in another go. I was like, wow, that's amazing.
Wonder who discovered that.
I wonder who, oh, that was you, Dr. Prasad.
Yeah, that's right.
One of the diseases they didn't talk about, and I was surprised, was cataracts. And Dr. Kort's like, I need you to pull that up. Okay. And so we wanted to talk a little bit about that. And so cataracts are really clouded, blurry vision. They have trouble seeing at night, and they have a real sensitivity to light. And those really are his symptoms. Do you want me to pull up the cataract one, Dr. Kort?
Sure.
Okay. I was surprised that they didn't. Let me see. Is this it right here?
So you and I have talked about this before, Dr. Prasad, and I believe that the cataracts are associated with the amount of blue light that we get into our eyes and what time we get that blue light into our eyes. But, you know, you can see really clearly here that, not really, that it's cloudy and dim or blurry vision. Can you read that clearly? We should blow that up, Jet.
I did blow it up.
Okay.
And it got blurrier.
Yeah. Trouble seeing at night. I can't even read that. Sensitivity to light. It's blurry for a reason, right? What is that one? I can't read that.
Double vision.
Well, yeah, but what's this one?
I can't even see it.
Yeah.
So these are 6 early signs of cataract. Okay. But here's the funny part.
She did that on purpose.
Here's the funny part is that I was trying to pull up these and I'm like, wow, these are all blurry. And I go, wouldn't that be really funny if I asked Dr. Kort to read it? And it was blurry. And so everybody on there was probably like, we can't read that either. But those are the symptoms that Dr. Kort has. And he really, you know, he takes the suite of products. We've only had one product for 8 years. And so we were very faithful. And now that we have this suite of products, the multi-micronutrient approach, how do you feel about the omega-3s? I mean,
well, you know, I think being sensitive, I feel a lot of the things that I put in my body, and it's kind of a cool thing when you bring out a new product. I feel the effects of it probably more than most people do. But I would say that the omega-3 was really the product that I felt the most effect from. And I felt it in my eyes. I mean, I felt it throughout my body, and we've tested for omega-3s, and I have a very good omega-3 count. Excellent count.
omega index.
An omega index. However, this omega-3 really changed my eyes. And it specifically affected my left eye, where it got clear within 2 days. Then we ran out of some product, and it was about a week or so, and it started getting itchy again and dry and starting to get a little cloudy. And so I'm really hopeful that being on the product, I take a little bit more than what's suggested on the bottle because I have this condition and it's no toxicity to it for me to take it 2 or 3 times a day. But I really do believe that it's going to help to break down that cataract. And you and I have spoken about that many times, about what causes the cataracts and what can we do about that.
Yeah.
And it's actually a really serious situation. I was talking to one of my colleagues, and Jet had also pulled up this information. But did you know that there is a 26% increased risk of Parkinson's as a result of cataracts?
No, I didn't know that.
Yeah. So, for me, I'm like, oof, am I tremoring? And
no, but the point is that, if you have an eye cataract, that means your body has a high oxidative stress.
right.
Including eye, not only in eye focus, but eye. If it is in eye, they are probably all over the body, and
Well, it may
therefore
not
it's
be.
possible.
Yeah, it can be
The dopamine
oxidative
level-
stress as well as sympathetic stress.
Yeah,
Which sympathetic stress we should talk about on another one of our optimal longevity series.
Which also causes dry eye, Dr. Prasad. So we
Yeah.
know that that's a symptom of a sympathetic systemic response is dry eye and pupil
Dilation, which is I want to go down this rabbit hole. So when you're stressed, like for instance, you see the bear, or you're seeing you're stressed and you're scrolling on your phone, and you're looking at things that are changing your heart rate, and you're having a dopamine reaction, because while you're scrolling, it is creating a dopamine reaction. So the pupils, what we see in people that have chronic sympathetic stress is dilated pupils. Now, a lot of the folks on this call actually remember the camera, that when it had an aperture. And what happens in our eyes is that the aperture is stuck wide open.
What does that mean?
Said another way, it's like looking at a Samsung television with binoculars. You have no protection from the light that's coming in, the radiation that's coming in. All the different components of our daily life are not being filtered by the one mechanism. This is cranial nerve 3, the Edinger-Westphal nucleus, which allows the pupils to get small when exposed to bright lights. And that is a big part of this story. What are your thoughts on that, Dr. Prasad?
No, I mean, I don't know a great deal about physiology or anatomy of nervous system. But I think as far as the cataract is concerned, we know that increased oxidative stress is involved because ionizing radiation is well known to produce it. People have measured it, and as I said, in countries where there is a lot of sunlight all the time, the incidence of cataract is very high because light, your eye get exposed to the light, and you are not taking much. Your body doesn't have omega-3 fatty acid as much, or any kind of antioxidant in your eye, and therefore you develop cataract. But if those guy takes Kort 4 plus the eye boost and plus 2 and digestive enzyme, and so then they will not have this issue right from the beginning. But once you have it a full-fledged cataract, the easy thing is, for me, I had a long time ago, 20 years ago when I was in Denver. They did surgery, 15 minutes. It's okay. Removed, and I started seeing very nicely again. Since then, it has never developed. So I think, if somebody has a already full-blown, their micronutrient cannot help because it is like a solid thing. You can't reverse it. The best thing would be to have removed surgically and make sure you don't have again.
Yeah. So we're going to talk about the next one, which is diabetic retinopathy. Okay. Which is going to dovetail into one of, I think, your absolutely most important patents.
Yes.
Your book. So
yes.
Diabetes. I mean, diabetes is rampant.
Well, it is. So let's talk about this one. I think this one isn't as blurry. So for everybody on there, I really did that on purpose, that I couldn't find one that wasn't blurry. And I thought it was kind of funny when Dr. Kort was trying to read it, that it was blurry.
Yeah, throw me under the bus there.
Sorry.
Or in front of the bus.
All right.
I didn't see it coming.
Why don't you go ahead and tell us a little bit about diabetic retinopathy, Dr. Kort?
Well, why don't you tell us a little bit about it?
Well, I'll tell you a little bit, and then Dr. Prasad will. It's damage to the blood vessels in the tissue of the back of the eye. And it is the risk factor is based off of poorly controlled blood sugar. Dr. Prasad?
Yes. Oh, so it is, then when you have for example, if you have a insulin resistance and you are developing, you already have a diabetic retinopathy, then what you do? Now, if you do earlier Kort 4, just Kort 4 enough. That's Kort 4 is enough for diabetes. You would not have this kind of developed retinopathy or a neuropathy or a nephropathy. It is the result of nephropathy, kidney damage. So eye damage would not have happened. But once you have it, and still, Kort 4 will be very important to further development or progression so that you don't get blind. So it is very important to prevent this one, you have to have Kort 4 right from the beginning as soon as your diabetes is detected or as soon as you become resistant, for example.
I wanted to say this, there are over 100 million people in the world with diabetic neuropathy.
Yes.
Okay?
Yes.
Diabetes is the leading cause of blindness in the working population aged 20 to 74.
Yes.
Right.
It's real big thing. And therefore it is very important. But again, one issue is prevention, where again, Kort 4 will be very important. And once it is like a specific case in retinopathy, then you have to take also eye boost.
I have a question. With children and the children's gummy, do you feel that could help prevent the propensity of children developing diabetes at an earlier age?
No question about it, because his body will remain in a low oxidative stress, no inflammatory events, and therefore they would not develop it.
I love that. No question about it.
That's awesome.
I mean, because those are two are the main culprits. And then, all these things, the what you call omega-3 fatty acid and collagen peptides, intestinal dysbiosis. Children don't have those kind of issues develop as yet. So if you take a precaution right from there at the time, you have a healthy child, your immune system will be good, you will have less infection, you grow old, and then if you are growing old, at that time, with or without disease, you may have intestinal dysbiosis. So when you become adult, you must have a probiotics.
Well, you heard it here. These are the omegas that we've got to give our children, not the little Swedish gummy fish.
Yeah,
right?
but in children's omega-3, the childhood depend upon how you define the children. I mean, children omega-3, I would say that it may not be appropriate if you are 5 years. And people give it. I have no idea because there is no data I have seen among children. But considering it is important, maybe you can do one a week or something like that, because they need also, just like anybody else, for the development of brain, for the development of everything. And they don't eat fish or any food like that. So I think, conscious or the science says that it would be okay to give them maybe a couple of times a week, so that at least you have a omega-3 sufficient amount, more than you don't take anything. And that might help. But
especially if their diet's high in omega-6s.
Yeah, omega-6. That's another reason.
Burgers.
I need to bring it back to the diabetic
retinopathy. Bring it back.
Gotta bring it back to that. So the omega-3s, Dr. Prasad, they did have a strong data on the diabetic retinopathy for a higher omega index, the DHA EPA ratio. And that was the omega index needed to be 8%. And that would decrease the amount of diabetic neuropathy, reduce the risk.
Yeah, I think that again, diabetic neuropathy, because as you know, omega-3 also works, because if you're, for example, the eye is a kind of nervous tissue. I don't know whether I have a separate, suppose you have insulin resistance. These are the things leads to diabetic complications, right? Otherwise, it will be okay to kind of medication they give. Once they become insulin resistant, and then, as you know, omega-3 is the only agent which can directly activate insulin receptor linked molecule called AKT. signally. And once it gets activated, it tells glucose transporter protein, which is lying idle in the cytoplasm, you come to the cell surface, and then they allow the entry of glucose inside the cell. So even in retinopathy, if you have insulin resistance, you have to first take care of the glucose metabolism.
Mhm.
And their insulin can't help you. The only agent can help you in this case is a omega-3 and collagen peptides, because collagen peptide also, what it does, the DPP4 enzyme, they increase, and once they increase, they reduce the secretion of glucose from the pancreas to the blood. So what collagen peptide does, it inhibits that enzyme DPP4. And actually, there is a FDA-approved drug which also inhibits the DPP enzyme. So they are given to the patient for improve the glycemic index. So here is the two agents that we have in Kort 4 that can dramatically improve at any stage you give them, for prevention, as well as the ones you have at any stage of the development, it will block further progression.
Well, and you have a patent on the microdaily product.
Yeah, I mean, we have a collagen peptide, if we got it. Probiotics, we are going to get it. And we just submitted on omega-3 fatty acid.
Beautiful.
It takes 2-3 years to get it, but at least it is in the process,
Well, and I think when we're looking at, one of your strengths, and you do have a book on diabetes that you have.
Yes, I've written it. Yeah.
Mhm. And I think that when looking at this, over 100 million people have diabetic.
I mean, that's amazing. I mean, this can be, that's why it is so important. I don't know how to reach many, many people, because doctors don't believe it if you say them it is, Kort 4. So until you do some clinical trial or something that can be published, it is tough.
Well, we do it word of mouth with this army that we're developing.
That's right.
It is those relationships and the people, if you remember a while back when we talked to Charles, and I don't know if he's on the call today, but he just wrote me, and his blood sugar at its highest was 650.
Yeah, I know.
And he was almost 600 pounds, and he's 6'7". He's a giant of a human being.
The response is 100%. We have heard that's a new, but
his
many
blood
people,
sugar, his fasting blood sugar is now 117. He's been on the product for 4 months.
Yeah.
Okay. His weight, now his highest weight was 600. He wasn't that big when I met him, but he's now, I believe he's below 400. Wow. And he's continuing to drop weight. But more importantly, he had to have another surgery on his foot. And some people have been on this call where they saw his foot. He had to have another surgery because he had an infection in the bone. And he just wrote me before the call, and he said, I think it was 2 months. I'm going to just double check. I think it was 2 months or 3 months that he's been out of surgery, and the foot is completely healed.
It is.
It is.
That's very important, because if you don't take care of foot healing, then they require amputation.
Right. And he said 2 months since they closed the wound surgically. It was closed last Friday, but officially it's closed. Now, I'm just going to show it. So don't worry, folks. It's not as gross as some of the other ones that we've seen. But this was a huge surgery. It was a scar all the way down his foot. But I'm just going to put it up here and let you see. I don't know if it'll come across because of the lights.
Oh, yeah. I can see it. Yeah.
But the sorry, I don't think it really comes across very well.
It doesn't.
But his foot is completely healed in 2 months. Now, the importance of that was that when I first met Charles in May 1st, he had this foot surgery where they removed the toe 5 years ago, and it never really healed.
Yeah.
And on May 31st, it was in extraordinarily bad shape. And just to recap, we took 3 capsules and mixed it with a tablespoon of organic coconut oil and put it on a gauze pad and packed his toe for a week straight. And he took pictures every single day. And there was tremendous healing by using the product on the outside of the body as well as on the inside of the body.
Yeah.
And, you know, when we look at somebody that we'll just call a raging diabetic who's not diabetic anymore.
No.
And his doctors are all scratching their head going, I don't get it.
Hang on. And the surgeon and the wound healing
The
folks,
surgeon, the wound
they
healing,
don't believe it.
the-
They're just in shock.
the surgeon who operated on him said, I could not believe when I went in to get the infection because he had osteomyelitis. When he went in to get the infection, he said, there was really very little infection that I had to clean out. I didn't have to debride much. I was able to sew it up. It's incredible how fast he healed. And I 100% believe it wouldn't have happened if we hadn't met each other May 1st.
Yeah, see, you saved the life.
Well, you gave us the tools. Thank you.
Sure.
So how we segued from diabetes and how it can affect your eyes.
Yes.
And over 100 million people. This is very serious. It's one of the leading causes
Very
of
serious. Yeah. I mean,
and then the foot. But I think that the strategies that Dr. Prasad and the patent that he has, and he's written many papers and many books on diabetes, so you can look those up if you're interested. But one of the things that was interesting to me, Dr. Prasad, in today's omega-3 course is that one of the areas that's emerging, there's not a lot of research, is hearing and omega-3s.
yeah.
And it's a new focus because they really want to expand there. And you have already studied that multi-micronutrient approach for hearing, and you've been very well published in hearing journals with your multi-micronutrient approach. Would you mind expanding on that a little bit?
Yeah.
For the people on the call?
Yeah. Hearing disorder, like one clinical study was done in Nashville by audiologist. And this person, they were mostly veteran, there are 40 million people in America have a tinnitus. But among veterans is also very high risk for tinnitus because of the noise. Musicians have a tinnitus, high musicians, they all develop hearing disorders one way or the other, especially tinnitus. And so we did it, and see, at that time we had original microdaily, that's all. And the study was for 6 months, and they found 70% of the participant markedly improved their tinnitus symptoms. And so I think even as late as one of the doctor I met in Los Angeles, who was the chief of the otolaryngologist there in a VA hospital or Mount Sinai, I forgot. I was at his house for dinner. And he said that he was in Vietnam and has a long-term tinnitus. And he has difficulty in sleeping and so on and so forth. So I said, at that time, we were just testing it. So I said, try our product, MicroDaily. And so he's tried. After 6 months or so, again, I went to visit people there, and I met him again. And he said, yeah, my tinnitus has improved. Because it's not totally cured. It is time interval was so long that it was not possible. But it dramatically improved. Plus, he said that his wife said, but another very important beneficial effect for him is that now he can go and play golf. Because of the knee, he could not play golf. So now it has improved it. Can you believe just one agent alone was at that time? But if he takes all these things at that time we were available, probably he would have done much, much better.
Mm.
But anyway, hearing disorder is a major health issue. And again, if you look the biology of hearing disorders, then again, same thing is involved. And therefore, omega-3 fatty acid being a very important fatty acid for all your organ, it will help more than just alone. And so I think the Kort 4 will be very useful, not only in the prevention, but on the treatment of also eye disorder, including age-related, sometimes it is age-related hearing loss. Sometimes it is also the exposure, the environmental agent, music, loud music. Mostly loud music is very deadly for the hearing disorders. And some exposure of chemicals could be also involved. So, yes.
And also individuals like our case study People that have EMF hypersensitivity are also have tinnitus.
Yeah.
Well, look at our veterans that have been blown up
Yeah.
or had blast injuries. And
Yes.
we have a patent for concussion and blast injuries as
Yeah.
well, don't we?
Yeah. And so I think, again, there also we have, as you know, we have a few examples that how it tremendously helped those people. And actually in a blast injury, which has a symptoms of dizziness and balancing problem, our product improved the efficacy of a standard therapy. And this was done in veterans who were returning from war in Iraq and Afghanistan. So I'm very happy that these kind of things is not that applicable to one disease, but in the multiple health conditions. And we are saying that, we are not saying that this is replace your visit to your doctor, or if your doctor recommends. For example, PTSD anxiety drug is a inhibitor of serotonin reuptake. It's an FDA-approved drug, routinely PA hospital recommends for anxiety disorder. But here we have a CBD does exactly the same thing with no toxicity.
Mm.
Well, this whole thing started with you walking the halls of the department, being invited to the Department of Defense.
Yes.
and
Otherwise,
bringing
I would not have known all this.
this formula that you created in your garage, right?
Yes.
This formula that you created in your garage with
Just
your lovely
theoretical
wife,
mind. Yeah.
right? Testing to make sure that what the cell could take, what it couldn't take, the
Yeah.
exact amount, no more, no less.
Yes.
And then to be asked by the Department of Defense, can this formula protect our soldiers from radiation,
Yeah.
biowarfare, and extreme stress?
Yeah.
The most amazing thing is that you already had the formula.
Yeah.
Then you had to get the money.
Yeah.
Well, you had to make 34 trips to Congress or to the Department of Defense, which means that you had 16 no's before you got that 17th yes.
Exactly.
And then you did another 16 no's in Congress before you got the yes. But then you didn't get the money. You had to write a grant to get the money, which is one of the things I love so much about you, Dr. Prasad, is your absolute ruthless tenacity for a goal and a vision that you had as a young boy, seeing such turmoil and damage with the bombs that were dropped in Japan.
Yeah, that stimulated.
Then you win the grant.
Earn
the grant. You earned the grant, and you got more private funding, and then you had to prove the formula that you created in your garage. You had to prove that it would protect the soldiers from radiation, biowarfare, and extreme stress. And we still were never supposed to see it. We were never supposed to get this, folks. Wasn't made for you and me. It was made for the military. It actually was proven for the military.
Yes.
Let's fast forward to where we are today. What is our life? Our life is exposure to radiation on a daily basis from the moment we wake up in the morning until we go to sleep. And if you don't shut your router off, it's all night long, 24/7.
Yeah.
Biowarfare, all the nasty stuff that we spray in our homes to try and clean our homes, and then extreme stress.
Yep.
In the last 5 years, the stress levels have gone up exponentially.
Exactly.
Across the board. All stress has gone up.
Yep.
I think it's just astounding how it dovetailed from the military need to the civilian need, and it just dovetails so beautifully in. I am so grateful, and I'm grateful for these conversations that we get to have every Tuesday night in the Optimal Longevity series. Jet, are we done, or are we going to keep going?
No, we're going to wrap up. That kind of leads me into two things.
Okay.
The stress part, we'll get to that in a second. Dr. Prasad, we will be discussing, because it's the month of October, cancer and breast cancer. It'll be my private journey as a cancer thriver. And we'll be talking about breast cancer next Tuesday. So for everybody to get people on the call that are going through it or have been in remission and they just have questions. So this is going to be a great call for them. And then we're going to take a break on the 31st. And then for the month of November, which is near and dear to our heart. And I see that Dr. Picola Roberts is on here.
Mm.
We're going to be having a month of November is going to be about mental health and addictions. And we want to be able to help all those people that are suffering, especially our veterans, and celebrating Veterans Day on November 11th.
I sent you the email of opioid. Did you get it?
I did get it.
Okay.
Yes.
You know, I think we're going to have a special guest in November that we haven't asked yet, but I'm very excited about what's coming in November. And we'll have to...
So I had some, great leadership of Beth Sturdivant and just asking for topics. And the topic she really wanted was mental health and addictions. And it's a difficult topic, but we're going to be talking about addictions,
Very important.
anxiety,
Very important.
depression, PTSD. So mark your calendars
Yeah.
for the month of November. We're gonna go at it and provide strategies. So with that, please get back to the person that put you on this call and say you're ready to get started. And there are so many people that have eye issues, and it could be dry eye, and we can go ahead and or ocular pressure. I mean, a lot of people have that.
That can lead to blindness.
It can lead to blindness, and that we have solutions that really are safe and they have no medication contraindications. So please get back and do that. And then you want to tell them where they can watch this?
Yeah, I wanted to add one last thing. Kort 4 is $6.67 a day. $6.67 a day. I have not had a latte for $6.67.
Yeah.
They're way over that. They're $7.50.
Yeah.
So, the sacrifice that you make for optimal health,
The investment in your health.
the investment, it's not a sacrifice.
No.
It's an investment, and the product is second to none. There is nothing like these products, and we are so blessed to have one formulator who CQF formula or standard is so specific that if it's not exactly Dr. Prasad's way, it's no way.
Thank you. Thank you, Dr. Kort and Joanette. I always enjoy every Tuesday working with you and all the participants that we are participating today. I thank them, and hope next time we have much more.
Well, next week on Tuesday night, the Optimal Longevity Series.
Breast cancer.
Breast cancer.
And, all cancers too, but
All
we're going to be
cancers.
focusing
And breast
on
cancer, but I
artery-
think you are correct. It is a cancer. The type of things that are involved is similar.
Right.
Um,
But it's a journey, it's a personal journey. So
Yeah, that's
bring
okay.
tissues.
bring
We
your
focus
tissues.
because something unique about a breast cancer, in terms of a stimulation of growth and things that is not for men.
Even men can get breast cancer.
Yeah, well, I don't know, but they get prostate cancer, which
No,
is
they do. Men get breast cancer. It's
rare.
not nearly as common, but they do get
Yeah,
breast
yeah, I've seen it rarely, but
cancer. Especially ones that carry their phone in their front pocket.
okay. Yeah, it could be.
So if you want to watch the Optimal Longevity Series, you can see the replays, this one and other replays on YouTube on Team Serve. And so with that, why don't we go ahead and close it out? You can unmute your mic and thank Dr. Prasad.
Make sure you subscribe to the YouTube channel. Thank
Please.
you.
Good night.
Thank you, Dr. Kort and
Thank
Jeanette
you.
and Helen and
Thank you,
and
Dr.
everybody.
Yes,
Thank
you.
you.
Helen.
Great call.
Thank
Thank
you
you so much.
Thank you. I hope you enjoyed our call tonight.
Bye-bye. Hey,
Bye-bye.
Good evening.
Good
night.
Thanks, everybody.
Wonderful
Journey is
information.
That
something.
was
Good
so
night.
good.
Thank you.
Good night.
Good night.
Thank you so
Good night.
much.
Bye-bye.
Night.